And tonight we are learning a 1-year-old child is recovering from a fentanyl overdose in Santa Rosa. Police had to do CPR on the toddler at a home on Boyd Street yesterday. The child is expected to be okay. Officers arrested the 39-year-old mother, saying her negligence was to blame. About 20 minutes south of Santa Rosa, the deadly combination of fentanyl and the horse tranquilizer xylazine is causing big problems at a tiny hospital. Tranq, as it's known, is used to extend fentanyl highs, but it can also constrict breathing. And tonight, Petaluma Valley Hospital says that it's having trouble keeping up with the number of overdoses coming through their door. Andrea Nakano on why the fight to save those lives is becoming harder each day.
Petaluma Valley Hospital recently had 3 patients come in 1 week, all of them in their 20s. They overdosed, all passed away. Hospitals say xylazine-laced fentanyl, known as Tranq, is causing a major crisis in their community.
We want to save lives. We don't want to say goodbye to people.
Wendy Thomas, the director of nursing services, has worked at Petaluma Valley Hospital for 25 years. The presence of Tranq has her extremely concerned.
For healthcare providers, the emotional toll it's taking on us is tough.
Recently, a young woman in her 20s was brought in here to the hospital hours after she overdosed. By the time she arrived, there was nothing doctors could do to save her life.
One of our patients was recently, an organ donor. And it broke all of our hearts. People came in on their day off to line the hallways as she was taken to the operating room to harvest her organs.
Thomas says the hospital is partnering with first responders and law enforcement to warn the community about the drug. While Narcan has been effective in reversing pure fentanyl overdoses, the combination of Tranq has made it extremely difficult to save lives. More Narcan has to be used in hopes of keeping a patient alive while the horse tranquilizer wears off.
There's times when we've used all the Narcan we have in the hospital. We've had to call our other hospitals to get more Narcan here, and we've had to actually order more Narcan to have on hand here in the IV form to be able to give patients because we've run out a couple times.
The hope is by getting the information out to the community, people will be more aware of what they put in their bodies.
If you don't know where it's come from or what's really in it, it could take one time for it to be lethal. One time.
Doctors say if someone has overdosed, to bring them to the hospital right away. In the case of that young woman, her life may have been saved.